This press conference is about naloxone, and this evening, Councilor Lewis and I will be presenting our second naloxone resolution. It'll go before City Council, and with a little bit of luck, I think we're going to get it passed. Naloxone is a medication that is used to block the effects of opioids and can reverse those effects of an overdose until medical aid can be given to help the victim. This bill, R-102, will allow and provide for placement of naloxone in certain city facilities that are frequently visited by members of the public. So why is this important, and why do we need this? As you may know, this is an often repeated statistic that we hear, a very sad statistic, and that is New Mexico continues to rank second in the nation for overdoses in all 50 states. In 2014, which is the last year for which we have data, there were 536 people who died statewide. And then over the last 3 years in Bernalillo County, we've had an opioid-related death on average once every 3 days. These statistics, as staggering as they are, come from people who use legally prescribed pain-killing drugs, as well as people who have used heroin. This drug does not care who you are or whether you're using it legally or not. And every life is sacred. Every life is sacred, and each life is worth the saving. Now, naloxone is a very safe and easy to administer nasal spray. If it's given to someone who has succumbed to, as a result of a heart attack or a diabetic episode, it does not introduce additional complications. To deliver a dose is very simple. It's a nasal spray. You put a shot of spray in each nasal, and then usually the person regains consciousness and stabilizes enough so that you are able to get that person to the closest emergency room. It lasts for about 30 to 60 minutes. And this resolution also sets up a methodology for the purchase and dispensing of naloxone by Albuquerque Fire Department. And these will go to the city facilities, as I mentioned. It also provides a train the trainer training to be given by New Mexico Department of Health to all employees who are responsible for those locations, like libraries, community centers, right here in City Hall as well. It'll be used as a supplement to first aid kits and should be considered a life-saving tool, just like a fire extinguisher. Many people worked on both of these resolutions, and I'd really like to acknowledge some of them now. Definitely Albuquerque Fire Department Chief David Downey, thank you, sir, for being here and for all of your help in making this happen. Of course, our U.S. Attorney, Mr. Damon Martinez, and Ms. Elizabeth Martinez, who couldn't be here with us today, but we certainly are appreciative of Mr. Martinez's presence with us. Our Chief Administrative Officer, Rob Perry, contributed to this, as well as Dr. Paul Roth, who's the Chancellor of UNM Health Sciences. And finally, Nicole Taylor, who's on our council staff. So thank you, Nicole. With that, I'd like to turn it over then to Councilor Lewis for any words that you'd like to add.
Thanks. I'll just briefly say, and Councilor Gibson mentioned a lot of people that have played a big role in this and helping educate the rest of the council. But Councilor Gibson has really spearheaded this, and when it comes to the city of Albuquerque and the council working together, with the chief and with APD. It was a privilege to work together with her on the last bill that was able to, we had unanimous passage in the council to get naloxone in all of our police vehicles. And so when we were looking at how to implement that, we were looking at timelines, and we were thinking, we're thinking of a good timeline, and Councilor Gibson was there to say, hey, there's no reason why we can't push this up. I mean, it's a need. We have this need right now. We can save lives right now, and so she helped us be able to, see that we can do this sooner or later. We can get this antidote into the hands of our police officers, who will, very soon, with that in their hands, be able to save people's lives, as well as what the fire department has already been able to do in Bernalillo County. And so, I feel like this is a long time coming, and Councilor Gibson has helped us to be able to, be a real catalyst to be able to get this done. And now having naloxone in these public buildings, the research that Councilor Gibson and our public safety have gone through to be able to identify these buildings, and the kind of training and just what it's going to take place, what's going to take to be able to ensure that that's there, and that that people are there that are qualified to be able to use it and apply it, when needed. And I want to thank the U.S. Attorney also, Dane Martinez, and his help, and they've really spearheaded efforts of opioid awareness, and some of the programs that are going on nationwide. David told me about a book, Dreamland. I just got through reading that book, Dreamland. I tell you, I recommend that book. When it comes to understanding the plague, the opioid plague that's just spread across our country over the last decade. It's pretty remarkable, and how much it's hit home right here in Albuquerque and New Mexico. So this is one way. This is one way that we're able to help people, to save lives. I mean, certainly we're not solving the whole crisis just with this with naloxone being in the hands, or being in our public facilities. But it's one way that we can help people, and certainly it's a way that we can save lives right now. And with that, I'll turn it over to Mr. Martinez, the U.S. Attorney.
No, go ahead.
All right. Good afternoon. I first want to thank and commend City Councilor Gibson and City Council President Lewis for their leadership in fighting this epidemic. By creating naloxone rescue kits, the City of Albuquerque is taking a leadership role in saving lives. Just as it is now commonplace to have a defibrillator in office buildings to save someone from a heart episode, these naloxone rescue kits will bring someone back to life from near death if they are suffering an opiate overdose. An overdose can occur when a high school student is taking opiate prescription drugs under medical supervision, for example, after a sports injury, or when an elderly citizen is taking opiate prescription drugs after a medical procedure. This epidemic affects the young and old, male and female. It does not discriminate, as Council City Member Gibson said. These naloxone rescue kits are going to make a difference, and they're going to save lives. And again, I commend the City Council members and the City of Albuquerque for taking this leadership position. Thank you.
Thank you, Mr. Martinez. And finally, we have Ms. Jennifer Burke, who has Weisberg.
Yeah, that's okay.
I always get that wrong, sorry.
They have to be complicated.
And she is truly a warrior in this battle, so it's very important that she's here today for this.
Thank you, Councilor Gibson. My name is Jennifer Weisberg, and I'm the Executive Director of Healing Addiction in our community and Serenity Mesa Youth Recovery Center. And I've been carrying naloxone with me in my car, my purse, for the last 5 years. My son passed away of a heroin overdose 5 years ago, and I had it with me, and I had it in his bedside table. Unfortunately, by the time I had found him, it was too late. He had already passed. But I have seen so many lives be saved by this drug that is completely harmless, that if you can't screw it up, you can't administer it wrong, you can't give it to somebody and have them have a allergic reaction to it and cause illness because of that. It's completely safe, and like the U.S. Attorney said, it's just like having a defibrillator. we could be in a public building where somebody might be struggling with opiate addiction, and this might be somebody we work with. It might be somebody, you know, a customer or a client, and before, you know, we probably would never even expect that they would be going something as severe as an opiate addiction, but it happens all the time. And having Narcan readily available is really important, and I'm really pleased at how well you know, our city has taken this bull by the horns and just kind of, you know, made sure that APD is going to start carrying it and make sure that it gets in as many hands as we can, because, you know, people always kind of ask me, well, why would you give somebody, why would you make this a big issue if they're just going to go out and use again? And yeah, that might be the case. You might save somebody's life, and then they might turn around and go use again. And they may be upset with you because, you know, you just killed their buzz, their high, because that's what Narcan does, is it brings them back, but it also kicks all the opiate receptors off of their brain and sobers them up really, really fast. But that person may decide that that's the last time that they want treatment after that. And so they may go back and use, but they may always remember that time when they overdosed and almost died, and somebody took the time to help them and bring them back from is an uncertain death. So I think people's lives are worth saving, every single one of them. And the more that we can educate people and get this in the hands of everybody, I think is really important.